Good evening, welcome to Simpson at 8. Fiji today announced another COVID-19 border quarantine case, a 61-year-old man that came from California. This brings the total border quarantine cases to 10 and the total confirmed cases for Fiji so far to 28. But while the focus has been on COVID-19, the pandemic that has swept the world upside down this year, this evening we'll be talking about a disease that has been with us for a very long time, and one which we have not found a cure for, despite years of trying. Joining me this evening to discuss cancer, and children's cancer in particular, is Dr. Ilisapeci Tuibeqa, Head of Department Pediatrics Unit at the CWM Hospital. Hope I got that right. I did, thank you. Dr. Ilisapeci, welcome to the show. Everyone's talking about COVID-19 right now, but the silent killer, cancer, still very much around. What are some of the latest numbers we have on cancer and children's cancer in particular?
Thank you very much for that, Stanley. In the whole of Fiji right now, we are looking after a total of 62 children with cancers, about 37 here in the Central Eastern Division and 25 from the Western. And last year, around about the same period, there was about 64 children we were looking after. And all I can tell you at this stage is that every year we diagnose 20 new children with cancers.
20 new children with cancer. Before I come into the types of cancer common in children, I was wondering if you can, I know there's awareness that has been going around, but I'd also like to take every opportunity to try and get the experts to tell us in a very simple way, what is cancer? How do you see the signs, the causes, and how it really works, and why is it so deadly?
Yeah. Okay, so to begin with, to simply state what cancer is that it's something in the environment, some chemicals, exposure to the environment, carcinogens that attack the normal cells of the body. They attack the bone marrow and even other cells of other organs in the body that makes it abnormal, and these abnormal cells proliferate and they become the main cell type in your body, and that's how you get cancers.
Right. So in essence, it kills off the cells that work to keep you going, eh?
It kills off your normal cell lines. There are 3 cell lines, and these abnormal cells proliferate and they grow in big numbers and they replace your normal cells, right. And that's what cancer is all about.
So it attacks any part of the body?
It attacks any organs, any part of the body, but there are just certain types and organs that are affected mainly in cancers. So
what are they?
As you asked, there are many types of cancers, and the most common types are the blood cancers, or what we all know as leukemias. And then that's the most common type, followed by lymphomas. And then there's cancers of the kidney, the brain and bone. And there's also eye and facial cancers. And as you've mentioned earlier, apart from COVID, cancers currently, there are no direct causes of cancer, so there's no definite cure. But there are risk factors that predispose children to cancers, and they come in various forms. So things like exposure to viral infections, so certain viruses can attack the immune system and cause cancers. There's exposure to radiation, there's exposure to chemicals, so all this destroy the bone marrow and the normal cells. And then there are some cancers that are genetic and pass down family lines.
So it's in the family?
It's in the family, so that's like cancers like the eye cancer, which is called retinoblastoma. So there's a particular gene that presents in families that causes the eye cancers. And then
this is in children, right?
This is also in children. And then there's been researches done in Fiji in the last 3 decades, and they found association in children with cancer. So things like an age category, less than 5 years of age children are more predisposed to cancers. The Itaukei ethnicity in Fiji, a low socioeconomic status, and also those with less access to health facilities.
So they're most vulnerable.
So they're the most vulnerable and have a higher risk factor when you compare them to other children.
So those ones that you were describing to me, those are various types of children's cancer that's common
Yes.
In Fiji. Leukemia, you said, was at the top of the
Was
list.
the most
blood
common.
ones, eh? And so this 67, you said that there was about 30 in the Central Division.
Yes.
And then around the country. When they came, like how early did you find out? Like when they come to you, how do you detect it?
Okay. Children with cancers very different from adult cancers.
Right.
Children don't usually go through screening processes that adults go through to be able to test and early diagnose for cancer. So for example, an adult can have certain tests done for prostate cancer. You can have certain imaging and tests done for breast cancer.
Breast cancer, yeah.
Yeah, but in children, there's nothing as much as that. What happens to children is non-specific signs and symptoms, which are recurrent and ongoing. They're persistent. And if the question of could it be cancer is not asked, then children present late.
So give an example, like some.
Yeah, so for example, there's a synonym that's been put up by WOWS on a banner, and it's child cancer. And C stands for continued weight loss that's unexplained. H is for headaches, early morning headaches with vomiting. I is for increased pain in the bones. L is for lumps, lumps and bumps in your body. So you can find them in your axilla, in the neck, and also in the abdomen. Then there's development of excessive rashes. You could have rashes.
Okay. So these are some clear symptoms to look for.
Very clear symptoms to look for, and also excessive bleeding. You may have normal cuts and it doesn't stop bleeding at the normal time, at the expected time. So there's excessive bleeding. Then there's recurrent fevers with unexplained cause, recurrent infections. Children get infections after infections. They get better, then they get another infection, and it continues. So these are the non-specific signs that can mimic other diseases. Like the common cold or the common flu. And people think...
I was just thinking
yes.
that it's similar to, well, some of it's not similar to the flu, but some is...
Yes.
But these are signs that parents need to be aware of, to look out for.
To look out for.
Yeah.
And early presentations, they need to present to the hospitals or the health facilities near them as early as possible, so that we can diagnose quickly and treat early as well.
Before we go to the break, what are you finding? Are parents aware? Is there enough awareness to people about... I know there's a lot about breast cancer, prostate cancer. There's a lot of campaigns, for the adults. But is there awareness campaign targeting parents to be aware of seeing the symptoms in children?
Yeah, so I guess this August month, which is being dedicated to cancer, WOWS is trying to raise that awareness. And if you're asking whether the parents are still presenting late, and the answer is yes, some parents are still presenting late. And as I mentioned, it's because of the non-specific signs. And we just need to continue year after year to keep creating that awareness. We need to talk to each other about cancer and the symptoms that we know of, so that we create that awareness, so that when children are sick, and especially when they're persistently sick with the same thing,
that should be a trigger, or
that should be a trigger
sign,
for parents to take their children.
All right, very important issues, and we cannot allow these issues to be drowned out by COVID, because they are here and they are deadly. We're going to continue this discussion after the break. Don't go away. Welcome back. You're watching Simpson at 8. We're with Dr. Ilisapeci Tuibeqa, Head of Department Pediatrics Unit at the CWM Hospital. We're talking about cancer in children. And before we went to break, we're discussing early presentation. It's an issue, a major issue, and we talked about the signs that one needs to look for and take note of, especially parents when it comes to children, obviously. Many parents are bringing their children late. How late is too late?
That's a very good question. We would say late is when there's a occurrence of symptoms just the first time. You need to be seen by a doctor already. If you're waiting many times after that and not asking the
Sometimes
question,
waiting
not
for it
being
to be too bad, really bad, then
exactly. We need to be seeing the children as soon as you know that there is a recurrence of symptoms. So just the second or third time you need to be seen already, and not a dozen times down the line.
Yeah, and then as you're saying that, it made me think that usually sometimes when something like that happens, for many parents, including me sometimes, the first thing that we do is look for the traditional medicine, the herbal medicine for the child.
Yes.
And it's in our custom, it's in our culture, that a lot of the treatments for our children, is passed down. But some of that could actually be, something more serious.
Yes.
And I just want to get your views on, how we do this. When you're mentioning lumps and, rashes, we all have the treatments for that. That lump, they'll get somebody to bombo it, to press it, and
Right.
and things like so. I just want to get your views on that. How we get through that? Because a lot of parents won't bring the child. As what I know, in the first instance when the thing happened, they think there's someone around them, or someone in the family who will be able to fix it first.
Yes.
Is that correct?
That's correct. Now, a lot of this stems from, ignorance. It's really not having the knowledge and the awareness on certain diseases, just like cancer, and also the belief systems we have, the traditional customs we follow. And so, how to tackle this is one person talking to another person about cancer, starting off at that point, and then if we have everyone talking about what cancer signs and symptoms or the treatments that are there to each other, then we create the ongoing awareness. And also there's information all around. This is the high-tech era where you can get information from just about anywhere, in books, online. Children can be made accessible to these, even parents. And for our Fijian herbal reliance, if we have a headache, for example, like you've mentioned, and even a lump, I think when you're having it recurrently, that's not the time to turn into traditional medicines or self-reliance.
Like you said, she's a trigger to...
Exactly. So
because not every symptom is cancer, but you can never be sure. And I think with cancer, you just can't take the chance.
You cannot take the chance, and you cannot sit back, because time is of the essence then.
Early detection is very key.
Early detection and early treatment.
Give an example of how early detection is important, as opposed to someone who's coming in late. Because obviously early detection means you can get to the treatment that you have, correct?
Yes. So for example, a child with leukemia, they would need to present as soon as they have any signs of a lump, or in the neck, in the abdomen, if there's signs of bleeding gums, if there's sign of excessive tiredness, bone pains, they need to come straight away. Because then the earlier we catch them, the earlier we diagnose them, their treatment journey is a very long one. And so we need to start them on treatment straight away, and walk the journey with them, because it's not an easy journey. It's 2 years of treatment, and there are challenges along the way, and we need to work with them as early as can be. And once we're on the treatment journey, we need to be supporting them all the way, because, as I've said, it has a lot of hurdles, and it's very challenging.
So we're always talking about resources available at our hospitals. What resources do we have for children's for children living with cancer?
Um,
Do we
if-
have enough?
If I may begin by saying that 40 years ago we started treating cancers in Fiji, and it started off in the main central hospital of Suva. Then we started treating in the Western hospital as well. The northern children, they come to Suva to be treated. And when we started, there was very limited resources. And at that time, we only began with protocols which we borrowed from Australia and New Zealand. And the recovery rates then, with the limited resources we had, was very small. We had started with almost 0% recovery, or
Basically, we had cancer, you died.
Cancer, you died. Remission rates were very low. Then we went to about 15, 16%, 30%. And then now our remission rates are at about 85 to 86%. So there's a dramatic improvement.
So we got enough to keep people.
We do have enough
Alive.
to keep people going, yes, and to even have cure rates. Our cure rates are more than 50%, 49,
Alright.
50% at the moment. We are developing. We've gone from certain chemotherapy medications which we never had, we're having now, and we're also having certain laboratory investigations which we never had, we're having now. And in the next 3 years will be very interesting, because the WOWS group, the WOWS organization, together with the Ministry of Health, are looking at developing a huge cancer unit that will, further improve our standards, our treatments, and even provide treatment to the region. It's not only going to be Fiji, it's going to be to the Pacific.
Okay, I'll hold the thought there. We're going to take a break, because I'll come back and we'll discuss WOWS in detail in our final segment. I hope you're enjoying this very enlightening conversation. Don't go away. Simpson at 8 will be back. Welcome back to Simpson at 8. We're discussing children's cancer and the work of WOWS. We're with Dr. Ilisapeci Tuibeqa, the head of the Pediatrics unit at the CWM hospital. Now, WOWS Kids, and you'll talk more about it. It's positioned now as the organization, apart from the Ministry of Health, of course, working on children's cancer. It was set up in the memory of Taikami, someone who I interviewed on this show 10 years ago. But if you can outline the services they provide and what important work do they do?
WOWS has done a lot for children with cancers in Fiji. If you ask any family that has gone through the oncology or the cancer journey anywhere in Lautoka or Suva, they'll tell you all about what WOWS has done for them. So WOWS has given through their fundraising events that they hold every year. And as you've mentioned, it was founded around about 2005, 2006 by Sina and Taholo Kami on the request of their daughter. And from then till now, they've held fundraising events every year to fundraise for children with cancer and their families. So the funds that are raised during these events, WOWS uses for facilitation of a lot of things. And one of them is they give towards the transportation costs of children with cancer, towards hospital access, and for reviews for their treatment, both mainland Viti Levu and from the outer islands. They also provide monthly groceries to the families in their homes, and they do home visitations. They provide accommodation of families.
So quite a lot of work. Eh? I'm just
A
thinking
lot of work.
I'm thinking how important this is, and I want to discuss that, because a lot of children, a lot of families that have a child with cancer, it's a huge workload, isn't it? It's it's a very tough assignment, so to speak.
It's a very long journey.
Long
yes.
journey, yeah.
So, some children with cancers, depending on the type of cancer they have, they get treatments for 3 months, 4 months, 6 months, and then there are the ones with leukemias who get a 2-year treatment. So it's a very long journey.
It's for a lot of care, it's a huge burden for some, in terms of caring. So this
Yes,
kind of
it is.
support is a big relief for many of them.
It's a huge relief. It's financial relief, it's psychological relief, it's spiritual relief as well. So all of that, the WOWs.
Yeah. So you're a doctor
supports.
at the ECW. I sense gratefulness, being grateful of an organization such as WOWs being around.
I cannot say, more than that, except that, let me put it this way, simply, I go to sleep at night knowing that WOWs will be there to lend a hand if we fell short in the public hospitals for the children with cancers. So, if there were diagnostic tests or medications that were not available in this country or even in the public hospitals, WOWs was there to give a hand, and that gave me peace of mind. And
a wonderful partner to have and to work with.
An excellent partner with other stakeholders.
Yes,
as well.
and a lot of committed people in WOWs, from Taholo and Sina, of course, and the whole team that's involved. We've seen them over the years, and they're a very determined team.
A lot of passion and a lot of commitment. Yes.
Now, there's so this month, raising awareness of children's cancer, which is why we're here discussing cancer while everyone's thinking of COVID-19. What's some of the activities happening this year? Because I kind of recall seeing a High Commissioner what shave his head. I saw something. So
Yeah.
what's happening this month?
Yeah, so this month there's 3 events that they've scheduled. WOWs has scheduled the Sangamoli Drive, for instance. So the Sangamoli Drive is cans and tins being widely distributed to various organizations in Suva and in the West. Nandi has come on board to help. So they're putting up this Sangamoli tins out in cafes, bakeries, business houses, and asking the public to donate Sangamoli into the tins towards WOWs and its activities. And places like MHCC, RC Manubai, and RB Centrepoint, they've given WOWs free spaces for information booths and for them to be able to also have a sale of WOWs kids merchandise. And all this are manned by a team of volunteers from WOWs.
And what are they're not the shaving this month, eh? That's different.
So that's one, and there's 2 others. So there's the Great WOWs Walk, which is interesting. Previous years.
When is that?
That is, it was launched yesterday. And this is an ongoing walk over the next 12 or 14 days. So it's very different from the WOWs Fun Walk we used to have every year.
Yeah,
exactly.
That's
So at my Super Park, we would all run and walk. But this one is going to be done online. So you have to download the Steps app if you're an Apple user. And if an Android user, I think they're using the walking and running health pedometer for Android users. You download that, and then you register to walk and raise funds with WOWs on their Facebook page. And then each individual is encouraged to raise up to $100 per person, and $500 for minimum of $500 for a group of 5. And you raise awareness through your walking in the app. So you're going to have to download this and then do your 50 kilometers walk over 14 days, and then you challenge someone else also to do the walk.
And yes, they get healthy at the same time while walking. But many ways to contribute, obviously, and everyone can play a part, big and small, in this raising awareness and contributing to this, because this is, it's as I said, it'll be happening all the time.
Yeah, and then there's the big one that you mentioned, the Ambassadors Shave or Save campaign. So that one, as you may have heard, is being initiated by the New Zealand High Commissioner.
New Zealand High Commissioner.
Yes,
Shave
so
his head, yeah.
His Excellency, Mr. Jonathan Kerr, together with 4 other heads of mission. So there's 5 heads of mission who are putting their hair on the line here with this Shave or Save campaign. So you know who they all are, don't you?
No,
So-
I only saw the New Zealand High Com so far.
Okay, so
I did see it somewhere.
yeah, so the British High Commissioner, Mr. Paul Welsh, the Australian High Commissioner, Mr. John Fix,
Wonderful guys.
the
All
American
wonderful.
ambassador,
Oh, wow.
yes, so Mr. Joseph Sella, and the French ambassador, Mr. Jean Francois,
I
together
met
with the
them
New
all
Zealand
nice guys, and I can
High
understand
Commissioner.
they put their heart
Yes,
in their work. So
they're putting their hair on the line,
and
or may I say
their
their
heart and their
scalps.
hair is on the line now. So I mean, wonderful gesture, and of course the rest of us, we can $1 at Sangamoli, and then we can walk, download it on the steps.
Yep.
And what's the other one on Android?
Walking and running health pedometer.
There you go. How difficult is it to raise awareness during a time when we're faced with, as I keep alluding to, this global pandemic that's like consumed many people's lives? How difficult is it to raise awareness, or is it just taking it all in your stride?
I guess amidst this COVID, Fiji is very fortunate that we don't have local transmission. As you mentioned, it's only happening at the borders, and the rest of the country is, they're having their antennas up, and we're all practicing safe distancing, the hand hygiene measures, and keeping within the restrictions and the curfews. And while we're all doing that, we're keeping our country safe. And as you said, we're also promoting things like cancer and the awareness of cancer as we go along. COVID hasn't, let me say, maybe in a light mood, it hasn't killed anyone yet here in the community. We've had border deaths.
With one death,
yes,
but
we've had
local
border
transmission
deaths.
death,
Local
but,
transmission deaths we don't have, but cancer deaths are ongoing. So yes, we will stand to still talk about cancer and how we can help improve the outcomes.
Yeah, so key messages, make sure we know what the signs are, act quickly when the signs to ensure early detection, and we're all in this together. We all have to support. We have to raise
We're
awareness.
all in this together. Talk to someone about cancer so that we all create awareness amongst our families, our communities, our friends. And we also need to find the time to donate. So donate at Sangamoli. Donate your expertise in kind. So we need counselors, we need volunteers, we need nutritionists, we need chefs, chefs that can cook soups, provide groceries and food, sandwiches for families that are going through this journey. So there's a lot of us that can help in kind. It doesn't need to be cash only.
Wonderful initiative, and one I know the Fiji community has been very strongly supportive of, and we must continue to be strongly supportive of going forward. Dr. Ilisapeci Tuibeqa, thank you for joining me on Simpson at 8.
Thank you.
Naka. That was the show for the evening. Hope you can contribute, and make sure you contribute, I will say, to the WOW's Kids campaign this month, August, in support of children living with cancer. That was Simpson at 8 for the evening. Good night.